Hey guys, Dr. Mike McCall coming at you like a body snatcher. We did a couple important things this weekend. We kind of reviewed the muscles. We got into the ileocecal valve. There's two kinds of ileocecal valve to treat. You have the open variety. 90% of patients have that. That is a 2-point therapy localization. Strong indicator muscle weakens if the patient pushes in between the belly button and the ASIS and pulls it up to the opposite shoulder, and then that muscle stays strong. That's an open. So remember, open up. If they pull up and the strong muscle weakens and then they push down and it stays strong, that's a closed ileocecal valve. So open up, close down. The reason why you got to distinguish open and closed is because that's the way you have to treat it. An open ileocecal valve is going to need, in Chinese medicine, kidney 5 or 4. Sometimes the literature changes around the ankle. A lot of times just adjust the talus, which you guys saw me do. And then you want to go to the left bladder 58, and that's just inferior of the lateral gastroc head, right where it becomes the sheet of fascia. Rub that. You have a neurolymphatic in the right bicipital groove, which is the same for an upper trap. And then you have the C3 lamina. Okay. You want to look at the vertebrae C5 and L1, which happen to be lovets of each other. 5 and 1 equals 6. Nutrition for an ileocecal valve. An open variety, you would want to look more for stomach, so more like hydrochloric type of things. Also, chlorophyll is a really big thing, and you want to look at adrenal desiccated. These people have a parasympathetic dominance, and you need to get their sympathetic balance with the parasympathetic. Closed variety is more of a pancreatic, sometimes liver gallbladder, kind of digestive contribution to it. They need choline because choline is used for the acetylcholine, which is your parasympathetic. These people are sympathetic dominant. The neurolymphatic is right here, same as small intestine, and it's a bladder 58 bilateral rub. You want to look at C3, L3, and that's how you treat it. So you find ileocecal valve, strong indicator muscle goes weak, they pull up and the muscle's strong, that's open. If they push down and the muscle's strong, that's closed. Okay. Both of them will come back with a vengeance if the patient eats popcorn or chocolate. It'll just come right back. As soon as they eat it, next day. So if these people are acute, you'll get them feeling better. They'll eat that stuff next morning. They'll wake up like they never got treated before. So you've got to get the popcorn and chocolate out. We demoed that with you. Okay. So we have our lovely assistant who just got through with part 4 boards. And so when I run through an ileocecal valve, I'll show you. So I like to start with iliacus. Iliacus is considered the most sensitive muscle for an open ileocecal valve. So I usually start with an iliacus. Knees straight, push up. Okay. And in her case, it's strong. And then you want to check rectus femoris. So a weak rectus femoris and a clear could indicate a closed ileocecal valve. Okay. Now, I'm not trying to confuse you. I'm just guessing where you're going to go next with this because I was in the same process as you. They're sensitive for that. So you can use any indicator muscle for ileocecal valve, but if you really want to be make sure you can find it, you want to use an iliacus if you suspect open and a rectus femoris if you expect it as closed. It's almost like I can look at the slide, the histological slide, no problem, but if I use the tool of a very sensitive tool of a microscope, I can see what's going on. So it's just on that order. Okay, you can cause any muscle to weaken with the ileocecal valve. Okay, let's get started. So in her case, say she showed a positive. So say this muscle was strong, and she put her hand here. You want to put the right hand over the left, double TL. And if the iliacus changed from strong to weak or weak to strong, we have a positive ileocecal valve. Now what we do is we have the patient push into the gut, pull it up to the left, and if it stays strong, it means the body wants me to do an open ileocecal valve. So what I usually do is I usually adjust the talus because that's where the kidney 5 point is, or you can stimulate with your finger with a laser, and if you have a license, you can acupuncture it. Then I say, all right, bring this knee up, and I go right to the inferior part of the gastric head, right where it turns into the connective tissue sheet, and I rub the heck out of it. In her case, she doesn't have it because her diet's good. Then I go to the bicipital groove, and I rub the heck out of that, and then I go right to C3 lamina, and I rub that. I look for a subluxation at C5. It can be any direction. I look for a subluxation at L1. Okay. If you have to say you want to find out and they can't use two hands because you need to open up a hand, remember to have the hand closed like this, not like this. You want the fingernails to be exposed because sometimes the ileocecal valve is a tricky thing to therapy localize to do. Now, saying we're going to do a closed now. So we have a strong indicator muscle, and I push, and she takes her hands, and we're putting them right over the same spot, and it weakens. I suspect it's a closed ileocecal valve based on that muscle. Okay? So one hand over the other between the ASIS and the umbilicus, McBurney's point. Then I have her push into her body and push 45 degrees down and to the right. And if that muscle's strong, it's a closed ileocecal valve. These people are usually your executives, your high-end people, people who are running. They're stuck in a sympathetic dominant mode. The open kind are like all of us students, and I got no more energy left. That's an open variety. So to fix it, I have to go to bladder 58. So I kick the legs up and I rub those at the same time, both lateral heads. But for a closed one, you do bilaterally. An open, you do a left bladder 58, kidney 7. So for a closed, bilateral bladder 58, you go into the ribs. And when you do the neurolymphatic for this, it's the same as small intestine and also for rectus femoris, is you don't go on top of the ribs, you go into the ribs, like you're coming over the ledge, and you rub all the way here like a V, okay, all the way to about mid clavicular point or at the nipple line, okay? So you rub those really hard and vigorously. You want to look at C3, L3, and then you fix it, okay? If it comes back, say the second visit, that's a good opportunity to ask about the diet and then try some of the supplements. For a closed ileocecal valve, I mentioned before, it's pancreatic generally. It's a good place to start. Gallbladder, liver related stuff. I give, in this case, standard process, I give a lot of AF beta food out. And then look at a choline. So what do? You just take those supplements, put on their tongue, and before you treat them, see if that makes everything strong. All right, so that's your ileocecal valve review. You guys did great this weekend. Remember the magic words. Go into challenge direction on the phase of respiration. It negates the challenge. And there's another one that I gave you. I can't remember. So just practice. Just don't worry about all the details yet. Just muscle test. Get that feel for the muscle test. Then you can go get the book and look at the details. But just get comfortable grabbing people and muscle testing and start to feel. It either has to be on or off. Oh, the other one, there's an exception. When you do challenge, if you do a vertebral challenge, especially a rebound challenge, you want to look for maximum weakness of a muscle, okay? And that's the exception to it's either on or off. All right, I'm going to see you guys in January, so keep up the good work.